guys, Amanda Brooks coming to you live from Bangor, Maine. I'm a physician assistant. I've been practicing emergency medicine for 14 years and opened a wellness center about 2.5 years ago where I'm really trying to bridge the gap between modern and alternative medicine. So today's video, sparked by so many people messaging me, even posting on my Facebook wall, and then a letter that I received from one of the hospitals that I'm working at stating that influenza vaccine is mandatory this year. And when I choose not to get my influenza vaccine, I will have to wear a mask and signaling to everyone that I didn't get this vaccine. So what I thought I would do today, you guys, because this is a very controversial topic, is I would talk to you about why I've chosen not to get my flu vaccine, why I choose not to get it, and why I don't vaccinate Arabella. So just looking at the numbers, the CDC reports actually that between the years of 2005 and 2015, the vaccine's been less than 50% effective more than half the time. So I'm always about looking at risk stratification. You guys that follow me know that I'm all about giving the body what it needs to heal itself. So for me, those numbers just aren't good enough. I mean, in 2015, 2016, we actually had a live viral nasal spray. It was 97%, had a 97% failure rate. So there are so many things that are happening with these influenza vaccines. I find it a little bit peculiar that everyone is administering these now. You can get your vaccine at the supermarket. You can get it at the drugstore, through your work. And people that are administering these don't necessarily know how to do this properly. Instead of injecting it properly into the shoulder, they might hit the joint. People, and this creates an immune response. So people are developing nerve pain in their shoulder, frozen shoulders that we call adhesive capsulitis, chronic pain. I was talking to my ex-husband last night. He's seen muscle pain after injections of influenza vaccines, as he's an orthopedic surgeon. There are repercussions for getting these influenza vaccines. People that are pregnant are recommending to get them, and they're developing miscarriages. And now we're recommending that children as young as 6 months are even getting these vaccinations. Now, I'm big into looking at medical research, but I'm not always the best at explaining it to you guys. So I'm really trying to dumb it down so that we can all understand. So there's this paper written by Cowan, and I think it was back in 2012. It looks specifically at developing influenza, contracting influenza the year after getting a shot. And what it essentially says is, hey, listen, if you got an influenza shot last year, you're more likely to develop a pandemic strain the following year. Okay, so what we have to do is we operate pretty much out of fear, all of us. So we're reading these newspaper articles about, this teacher developing influenza, going on life support, developing pneumonia. Number one, let's look into the article a little bit. Did this teacher have the influenza shot? I mean, most teachers, guys, are vaccinated. So we kind of just have to read between the lines. You kind of have to develop, you have to discern for yourself what is right for you. So I'm definitely not telling you what to do. Look at the research though. So if you knew that if you got an influenza shot last year that you're going to be more likely to develop a pandemic strain the following year, would you necessarily get the vaccine? Would you give this vaccine to your kid year after year after year? I mean, I'm not talking about conspiracy theory, although we could, but I'm talking about the hard cold science. Have you guys heard of the Cochrane collaboration? This is a highly renowned, independent analytical body. They've looked at the research over and over and over again, and guess what? They can't recommend the vaccine because the data, it's not even neutral. It's less than neutral. And so for me, like I said, I think if we look at it, you have to treat 71 healthy adults with the influenza vaccine to prevent one of them from contracting influenza. Doesn't seem to make much sense. So like I said, the science isn't there. Now, if you get the influenza shot, in my opinion, you're more likely to get the flu this year. You're more likely to develop a pandemic strain the following year. You're more likely to shed viral particles out into the community. You're more likely to affect herd immunity. To me, that doesn't signal or signify that we're enhancing public health. And so my platform, it's all about improving health, right? Like creating a body, optimizing the way in which your body functions so as to prevent disease. Because the influenza shot, what it does is it affects your body's immune system. And over time, we are seeing a very detrimental effect. So what you guys can do, hey, make sure that your vitamin D levels are sufficient. Right? I'm coming to you from Maine, okay? We have a lot of sun in the summer months and then not so much. So our bodies, they make vitamin D, but not if they're not exposed to sun. So make sure that you're not vitamin D deficient. So supplement with vitamin D, okay? That's easy. I just did a video on On Guard, the essential oil. That's a great thing to have diffusing in your home, to be using orally. We have research to suggest that it actually combats influenza. It prevents the virus from shedding, which this is awesome. We also want to make sure, hey, antioxidants, these are great to take when we're looking at old school technology, because this is a supplemental technology. But you guys, there's a way for your body to make its own antioxidant enzymes, and that's by activating your NRF2 pathway. So if you haven't heard about NRF2 activation, if you're interested in it, if you want to like go into this flu season at your best, contact me. Start taking a probiotic, enhance that gut, okay? But these are just some things that I wanted you guys to take to think about, okay? So don't operate out of fear. Do your own research. Hey, start following or look into Dr. Suzanne Humphries. She's an amazing researcher. She's double board certified in internal medicine, nephrology. She actually practiced in my neck of the woods. She is a woman that's done more research on vaccines than I can even imagine doing, but she's absolutely amazing. So, hey, also, when we're looking at these headlines about people dying from influenza, I was looking at a few notes that I took because I was reading some articles. They don't talk about these people taking Tamiflu, which again is a pharmaceutical that I think I spoke about in my last video, and administering ibuprofen, which can be toxic to the kidneys for fever control. So there's just a lot of things to think about. It's not, we like to just pinpoint, pin everything on influenza. It's not necessarily the case. So you guys, don't take my word for it. Do your own research. Figure out what's right for you. I'm just trying to provide a little more clarity, but look into this. And don't do anything you don't want to do. Be your advocate for your own health. You guys have got this. Hey, thanks so much. Hey, Tina. Hey, Kathy. Hey, Kristen. Thanks so much for tuning in, guys. Share this with someone that you know. When you see me in the emergency department and I'm wearing a mask, it's a statement, because there's no way in hell I will get that vaccine. So, hey, take care. See you guys later. Ciao.